Good morning. We are going to spend the next 40 or so minutes talking all about the EKG. My only disclosure is that I inherited this talk from Sally, who's done a really great job giving this talk and another one for the past several years. So just a big thank you to her for her past work. Objectives for today's talk. We're going to review and identify normal ECG measurements, go over the basic methods and concepts for interpretation of the 12 lead, identify common ECGs that are important to practice, and go over a brief review of common treatment modalities based upon ECG findings. We're going to start with the basic approach, and then we're going to move on to conduction system, touching on premature beats, tachycardias, cardiac arrest, blocks, bradycardias, and then electrolyte abnormalities. Okay, basic approach to reviewing an ECG. I find it really important to do the same thing, go through the same sequence, touch on the same things for every ECG. It's really easy to have your eyes kind of stick to one or two abnormalities, and then you're missing something else there. So whatever approach works for you, just do it for every ECG you're looking at. You want to pay attention to measurements. What's the heart rate? How long are certain intervals, such as the QRS, the PR interval, the QT interval. You want to look at the rhythm. I try to identify what is the underlying rhythm. Look for any extra beats or abnormal beats, such as PVCs, PACs, etc. You want to look what the conduction system is doing. Are you seeing any bundle branch blocks, AV blocks? And then look at the waveform. So look at each waveform morphology and try to see if you can see any patterns or abnormalities. For instance, when you're looking at the P waves, does each one look the same? Do you see any notching or peaking that might indicate some atrial size abnormalities? The QRS complex, are you seeing any pathologic Q waves? The ST segment, do you see any depression or elevation? Seeing any peaking or inversion of T waves? And then U waves, are they there or are they not? Then you can put this all together and make your final interpretation. And one caveat that I find really important is always look back at somebody's old ECGs. Some people live with some abnormalities that for them are normal and we don't need to be concerned about, but always compare to old ones if they're available.